My name is Dr. Lalita Iyer, and I am an Executive Medical Director, GP, and lead on women's health. I'm pleased to say that the COVID-19 vaccination program is vaccinating thousands of people across the country successfully. Thanks to the rigorous testing and approval process, we know that these vaccines are safe and effective in protecting us against coronavirus infections and also save thousands of lives. They are also a way out of this pandemic, which has caused untold misery and put immense pressures on the NHS like no other. Some of you may be worried about having the vaccine when invited because you've either had misinformation or are not aware of the facts around vaccinating certain groups and people. This includes the COVID-19 vaccine and fertility. I'd like to reassure you that the COVID-19 vaccine does not affect your fertility. Rumors that they affect your fertility are entirely speculative and are not backed by official data.
Hello, my name is Dr. Fatima Hussain and I'm a consultant obstetrician and gynecologist and fertility specialist. Many of the questions I've been asked recently relate to the safety of the COVID-19 vaccination during pregnancy and whether this vaccination affects fertility. The Royal College of Obstetricians and Gynecologists has published a statement recently which confirms there's no current evidence to suggest that the COVID-19 vaccine affects fertility. Furthermore, there's no known risk associated with pregnant women receiving this vaccine, as it's not a live vaccine. This means it cannot replicate and cannot cause infection in you or your unborn child. At present, the vaccine is only available to pregnant women with high-risk medical conditions who would fall into the clinically extremely vulnerable groups. These women have a risk of developing severe illness with COVID-19. The other group of women is the health and social care workers, including carers in residential homes. These women have a high risk of catching the virus, even if they themselves are at lower risk of complications if they're otherwise well. If you fit into either of these two groups, my advice would be for you to discuss the benefits and risks of the vaccination with your healthcare professional. You may also want to visit trusted websites. Finally, there's no current advice to avoid pregnancy if you've had the COVID-19 vaccination. Thank you and stay safe.